Good morning, everybody. It's Dr. Schulz. Just getting today's video out, and sorry for a little bit of a delay in it potentially, but wanted to cover a little bit on what exactly is an exposure when it comes to COVID-19. So first of all, I know there's been a lot of talk out there. I've gotten a whole lot of questions about what classifies as an exposure and when should we be going through the infection control process on this. And we'll touch on the infection control process itself a little bit later. But for now, in terms of what classifies as an exposure, first of all, the patient has to meet our case definition, which is available in the medical notes, which are available on the hfdmd.org website. And these are fluid. All right. It is 5:45 on Wednesday morning. This could change today. The CDC keeps changing kind of what they're considering. Agencies keep looking at it and kind of seeing how they're interpreting. There's multiple documents. There's no one clear place, though we're trying to stick as close as possible to the CDC guidelines. And so when if you don't have a potential COVID case, then it's not necessarily an exposure. Okay. The next thing to know about is that the PPE is based on droplet transmission. All the science we're seeing at this point shows that points to this being a droplet transmitted disease, meaning that when I cough or sneeze, those droplets come out, and the virus is carried in the fluid, it needs some kind of medium in the droplets, which is why it can stay on surfaces. Which is why we can kind of predict roughly what a safe distance away. It's not floating around there in the air trying to come find you. Okay? And the way I classify exposures, and you've heard me say this before on previous videos, is I think of it like a radiation exposure. Time, distance, shielding, right? So we'll start with time. If you're in that bubble, if you're in close to the patient for a short period of time, per the CDC guidelines, which are specifically geared towards healthcare workers, and we actually use the guidelines geared towards healthcare workers exposed to known cases. So we're essentially treating every COVID suspect case from an exposure standpoint as if it's actually a case. And as a general rule, the vast majority, again, as of this morning, I haven't gotten the numbers from last night. I think we've transported one patient who was positive, ended up being positive that we know of. But the vast majority of these patients are not COVID patients, but we're treating them like they are because they meet our case definition. But if someone were to say roll past you in triage, or you were to step into a room, you find like you're a couple feet away from the patient, you ask a question or two, you go, oh, this is not good, and you back out. As long as that patient didn't cough directly on you, where you're like, okay, I definitely got droplets on me from this cough, then it's really not an exposure. The Houston Health Department defines an exposure as within 6 feet for 6 minutes. All right, so you got to be in that space outside of being directly coughed on for a pretty long period of time for it to count as an exposure. You can minimize that even further by getting that surgical mask on the patient, because that's going to minimize the chance for them to kind of cough directly on you, contain those droplets, and not have them aerosolized in the room. The next one is distance, and distance is pretty straightforward. Again, 6 feet. The studies show, and I use this in the hospital when I'm working there, outside about 6 feet, those droplets don't travel. So certainly in the back of the ambulance, you're within 6 feet. But if I'm standing at the door 10 feet away, or if we're outside and I can stand back and I can ask my questions from there, I'm not exposed. And this goes back to what we've talked about before, is expose as few people as possible. So if you've got a bunch of, if you've got your whole crew there, or you've got multiple apparatus there, gear one guy up and let him go assess the patient. If the patient's critically ill, you're going to need multiple people. But 80% of this illness is generally mild. They can probably walk to the ambulance, right? We can potentially minimize a lot of our exposures that way, depending on the situation. But there's no reason, if a transport unit makes a call, that the EO can't stand back at least 6 feet away, be involved in the conversation, know what's going on, know what's happening with the patient, maybe work on the tablet while the in charge, or vice versa, gets the PPE on and steps forward to actually take the vitals, do the physical exam, and actually assess the patient hands-on. And the third part is shielding, right? And there's been a lot of talk about the PPE out there. The shielding, that the guideline is changing. Like I said, it's almost 6 o'clock in the morning on Wednesday. What's going to count as PPE as of now is what's in our guidelines. The CDC could change their guidelines. It's a very fluid situation. Right now, you guys know what the PPE is. All right. If you wear the full PPE, and I've said this over and over and over again, and this is kind of what we've been talking about. First of all, gloves, glasses, every EMS run. All right. That gets you partway there. You're protecting the mucous membranes. You're protecting your hands, which is probably the most common way where you touch something that's got virus on it. You touch your face, you bring it to you. All right. You're adding the N95 and on you and a surgical mask on the patient. If there's any concern for flu-like symptoms, cough, congestion, shortness of breath, or fever, all right, that puts you in a low-risk category in almost every case. But I will say, if you wear the full PPE, including the gown, there is no condition based on the CDC guidance for healthcare workers exposed to confirmed COVID-19 patients. And we've already said most of our patients at this point, as of the 18th, are not COVID positive. Most of the ones that have been tested. Based on that guidance from the CDC, if you wear the full gown, the full dress out, the recommended PPE from the CDC, you are never more than a low risk. Okay, so if you're wearing your PPE per the guidelines that have been put out, you're not going to be more than a low risk. And that means you don't have to go home. You know, the whole process in terms of what's a low risk exposure versus the high risk ones, you're protecting yourself, you're protecting your crew and your families. But in terms of exposure, just remember time, distance, shielding, and remember, especially the time part, if somebody rolls past you in triage or there's a brief moment, your odds of exposure are exceedingly small, and we're very comfortable with that particular situation. All right. If there's any questions, feel free to reach out to infection control or to medical direction, and we're happy to answer those for you. And with that, have a great shift. Be careful out there, and I'll see you guys around.